surgery in the mouth, he should know something about these things. If you don't know صار عندك مشاكل ما تلوم إلا اللي بتعمله واللي بيعمله. surgery ما تعريف بالسيرجري is a discipline, you know the meaning of discipline. هي زي يعني خلينا نحكي المهمات based on the principles that have evolved from basic research and centuries of trial and errors. هاي بعد قرون من المحاولات والأخطاء والريسيرش وشيء حتى عملوا السيرجري اللي احنا هلا بسهولة، والإنترنت سهل علينا كل شيء وبيوصل للكل. These principles pervade every area of surgery, whether oral and maxillofacial surgery, periodontal, gastrointestinal surgery, any surgery, the same principles اللي حكيناها. هذا المثال اللي بدي أعطيكم إياه. هلا أنا في عندي مريض وكان كنت أشرف على سنة رابعة، هذا الحكي في السنة الماضية بالذات، بداية السنة الماضية. طالب سنة رابعة بده يخلع lower posterior tooth. طبعا اللوكال انستيزيا lower posterior teeth molar. What kind of anesthesia we have to go? inferior alveolar nerve block. الطالب كان هو بيخلع، وأنا بصراحة مش طالب من أروع ما يكون وشاطر وكويس يعني، ويعني لم يخطئ، وبعدين طالب بده يتعلم. اي دي بلوك. كان مشرف عليه بنفس اللحظة اللي أعطى الاي دي بلوك ريزدنت تخرج ونجح في البورد الحمد لله، ومن أفضل الريزدنتس اللي كانوا معي الدكتور عبد العزيز شوا، إذا في حد منكم يعني بيعرفه. كان هو دايركت وأنا كنت مشرف على الجروب كله يعني. بعدين الدكتور عبد العزيز فجأة بيناديني بحكي لي الدكتور زياد في عندي خبر مش كويس. بحكي له وات؟ بقول لي النيدل broken during ID block. حاليا this complication can happen. It's a complication okay and not a mistake. مضاعفة يعني، ولكنه ليس خطأ، مش خطأ طبي، ما في خطأ طبي. This can happen with anybody. ID block راح تعطوا ID block. أنا مشان هيك أنا بحب أبلش، وهذا المثال أول مرة أنا بتطرق له في محاضرة لأنه صار السنة الماضية. أوكي، وكنت معطي المحاضرة هاي أصلا أوريدي، هو صار السنة الماضية في أعتقد شهر 4. وكانوا مستعجلين الطلاب بدهم يخلصوا الريكوايرمنتس قبل نهاية العام وكل شيء هيك، فلسه. هلا الشيء الوحيد أنا طبعا ما كنت شايف المريض من البداية يعني، وطبعا والدكتور عبد العزيز هو كونه ريزيدنت أعطاه ستارت وذي ستارت كل شيء. The only thing the patient fit and well healthy بالأربعينات. The only thing which is unusual إنه عنده severe gag reflex. طب أنتوا بتحكوا هلا، طب شو السبب؟ ليش انكسرت؟ البيشنت من كثر ردة فعله، لأنه he touch طبعا الطالب he touch the oral cavity, he touch the tongue, he touch the pharynx. أوكي، الموفمنت اوف ذا مسلز بتعرفوا الجاج ريفلكس كيف بصير تنشن وبصير ريلاكسيشن وكونتراكشن، ريلاكسيشن وكونتراكشن. which is the area. هلا نيجي للاناتومي. انا حكيت لكم بدنا نعرف اناتومي. what's the area name? the name of the area that you are giving the local anesthesia in, and what's the content of that area and what's surrounding that area. Okay, it's pterygomandibular space which is medial to the ramus. Okay, what muscles involved? What's other spaces? It's just lateral to lateral pharyngeal space. What's posterior to this space? Very important. We have carotid sheath. We have very important vessels. We have أنا هلا بورجيكم بالضبط الاريا. This is exactly dot the beginning of the needle. CT scan طبعا. This is called axial section. شايفين؟ This is طبعا الرايت سايد. هذا زي ما انتم شايفين. This is the right side هون. This is the tip of the needle. This is the needle itself. شايفين؟ This is the pharynx. anterior mandible. This is the ramus, medial to the ramus. You see how close? And here in this area, the carotid sheath. This is posterior view of the CT scan. Can you see the needle? Of course, you can see it. And how long the needle? Of course, what to do? It can happen with everybody, with anybody, and nobody can blame you. But the only, maybe it's not a mistake, but جل من لا يسهو. Maybe this is for him, it's much better to do it under sedation or general anesthesia if he has severe gag reflex. كم واحد منكم بيعرف كم واحد عنده severe gag reflex? Just gag reflex. He has no any other medical problem. And this is what happened with him. And you see exactly the area, as you can see, the airway, of course, the spinal cord, as you can see, and the carotid sheath. Can you see it? Okay. Just attached to it. So I'm sure انكم هلا طبعا بتحكوا what I did. خلينا ننتقل بقى. What I did for this patient. Of course, he needs admission. I admit the patient. I put him under general and under IV antibiotic, and I told him let us wait because I tried immediately to take it out. But unfortunately من severe gag reflex disappeared. النيدل انكسرت واختفت. هلا ممكن حد منكم يقول طب خلينا نفتح جراحيا immediately. If you open immediately without any CT scan, without any view like this, you will dig in a blind area and you might have a serious problem later. So immediately you have to stop. I admit the patient, عملت له CT scan, حكيت له بعدين خلينا نستنى لغاية بكرة الصبح. كانت هو بعد الظهر لغاية بكرة الصبح. بدنا نعمل لك another CT scan ونشوف لأنها ممكن تطلع. What's the fate of this needle? Some people they'll say, I mean, this area is dangerous, we can't leave it. But other areas we might leave it. Might be fibrosed, okay? Or might be come out by itself and might be fibrosed and be within fibrous tissue. It's harmless. Better than to dig around. But the next day, when I did another CT scan, I found it deeper and more down. How we'll take it out? Anybody suggest?
Surgery.
By surgery, laparoscopic surgery, or it's called by microscope. And this is the opening. You see? As you can see, this is the teeth, the posterior teeth. طبعا we remove the wisdom. هون الwisdom كان. This is 7. This is the area. We opened this area. We opened it down maybe 30 centimeters. Okay? And the needle was in this wall. And this is the pharynx. We are just lateral to the lateral pharyngeal space. Serious area or no? Okay? The patient might die or no? And this is exactly after we opened and we exposed this area. Of course, this is deep. This is by microscope. And we take a picture for this. Okay? طبعا not myself, I did the surgery. Me and Dr. Omar Sarairi. He's ENT, the best surgeon in ENT, and he's doing microvascular surgery. It's kind of microvascular because we use the microscope. Okay? And this is the needle, it's intraoperative. Okay? This is the needle. Intraoperative. We took this X-ray, and this is the tube for the surgery. You see the area? And this is the length of the needle. About 3 centimeters. Okay? What do you think? Can we leave it? Of course, no. All of this happened. Why? Because we have lack of knowledge regarding the gag reflex. We had no experience about the anatomy, how serious the area, the main things. Today, because I've seen, of course, today just was like introduction. We did just demonstrate. We didn't show you how to do extraction. Next inshallah, next clinic will teach you how to do extraction. But the principles, please, you must remember it. What I told you about. Okay. Now I'm going to repeat uh, things, but please remember. I'll advise you because I read an article about this. Not article, it's case report. I made a case report and published within 1 month because it's serious problem. I didn't to expect that it will be published in this quick. Acceptance and publishing. I want you, all of you, to read this article. I'll send it, of course, to Dr. Wasim, who is your representative, and I'll send you the whole lecture. I'm not like my other colleagues. Don't worry, I'll send you the lectures. So don't worry about recording or not recording, but I'll send you everything, the article and the lectures. Please read the articles so you remember it. You remember everything, okay? Of course, with colleagues with me and students and residents, but I'm the main author. Okay. Now let us talk about something else. Okay. What's maxillofacial surgery? What do you mean really my maxillofacial surgery? Of course, it can be just minute things, simple things. I'm sure most of you know about this picture or about this founding. It's what's this thing called? Denture induced.
Hyperplasia.
No, denture induced, like edentulous patient. She has this patient, or he is a male patient. He has loose denture, which is the looseness of the complete denture. You have no idea about complete dentures and this, because after sometimes it will be fit very well, but after 1 year it will be loose because the bone resorption will stay on. Okay, but the patient is ignorant and he's eating with loose, mobile denture, and this is denture fissuratum. This is very simple surgery, and we can take it out just by electrosurgery. Knife, I don't advise you to use knife here, because it will leave big scar, the knife, and it might cause a bleeding, and it might make it shallower, the sulcus, because you need good sulcus. You see, that's what I'm saying. Embryology, anatomy, okay, structure, sometimes histology. You have to know some things about this thing, but it's very simple surgery. This usual surgery, it will take 10 to 15 minutes, just under infiltration, no ID block, no any block or infraorbital block, just infiltration. And you can buy laser or we have like electrosurgery or diathermy or cutting diathermy. We have it in our clinics. Okay. What's this? This is very common problem. Just missing tooth. So what to do in this? This is I'm talking about تنوع خلينا نحكي in our specialty, but these are just dental alveolar, just missing upper right central, which is 1-1, and needs treatment for this. The patient is willing to pay. What's the first option for you?
Implants.
Implant. Excellent. This is, and everybody from you are waiting just to graduate, inshallah, in order to start, because this is how to make money quick. Is that right? Okay. But there is a principles for implants, and these principles I mentioned. Of course, سنة خامسة, and on Thursday كمان I have the first two. I don't know why my luck like this. رابعة وخامسة أول محاضرتين دائما إلي. انا هيك تعودت من زمان، من قبل ما اسافر على السعوديه، وذا سيم ثينج. رابعه وخامسه بدي ابلش معاهم في الامبلانتس. الامبلانتس there is lots of principles. مش القصه مش بس انك افتح على البون دريل put the implant، لا، في principles الامبلانتس. اوكي، the same things. احنا هلا دورنا to teach you these principles. Okay, dental implants. This thing can be very serious things, but it looks just simple things. Okay, this is atrophic wound after extraction. Okay, which caused atrophy caused by infection. Infection will cause lack of blood supply. The doctor just ignoring. The infection can appear with any necrotic tissue. Okay, he didn't clean the area. He left granulation tissue. I don't know exactly what he did, but the patient definitely, if you don't do the principles of doing any surgery, he did the extraction, but it was a traumatic extraction. He removed the tooth, traumatic extraction. Of course, what I mean by traumatic extraction, he broke the crown, then he take it in pieces, and then he tried to do the in trauma in the wrong instrument to take the to elevate the roots in a wrong way. So he broken the roots, and some of the teeth came with the root. Okay, so, and he didn't clean it very well. This must be surgical flap, just to open a flap. These are the principles. If you have difficult, anybody of you, me, anybody, regardless how good you are, you might face difficult extraction. You have to do it surgical extraction, which means a flap, use good sterile instrument, use necessary equipment. If you don't have, you can ask your friend or send the patient to your friends, or go with the patient to your friend, whatever. But please, you have to treat the patients in a good way. But once you started doing this kind of silly mistakes, you will end up with lots of trouble. And now في تعرفوا قانون المساءلة الطبية هلا بلشوا يطبقوه. There is lots of problems, in the courts with lots of dentists, especially طبعا not like this not that common الحمد لله. بس الكومن واللي فيه مشاكل كثير في المحاكم الآن عندنا في الأردن من والدنتست واقعين فيها، اللي هم الفيلر والبوتوكس وهيك شيء. لأنه جي بيز they just GPs do go have some courses in filler and botox and start doing this, and there are so many mistakes happen, and mainly because they have no principles, because they didn't teach usually these people, the business people, they are just want to make business and let you do the mistakes. They don't care, they want just to sell you with filler and botox. But you must know the principles. Go, and you can do the filler and botox if you are good. I have no objection, but the objection, you have to learn very well, know the principles. For example, if you want to do, for example, botox, botulinum toxin, which is toxic, of course. The idea of botulinum toxin اللي هي مشان إزالة الرينكلز أو التجاعيد in the for example in the area of wrinkles حتى بتضل النضارة. طيب, if you know the principles, if you inject the needle in the neuromuscular junction, if you know it will be irreversible. Do you know that? They just put the needle and they inject you. They don't know where the injection. They have no idea about this principle. So what will happen? That the patient will have no response or bad response or very of course the regeneration, the degeneration of the muscles will not happen, or it might happen just for a short period, for 2 weeks, and the complaint will start. So these what's my opinion about teaching you the principles. I can't tell you the principles of every part of maxillofacial surgery, but the things that you must know. Okay, of course, this is very common surgery that we are doing it, which is called osteotomy or orthognathic surgery, Lefort 1. You know, this patient, of course, as you can see, this patient has orthodontic treatment, and as you can see, and this cut, Lefort 1 fracture, of course, surgical fracture. We making this cut in order either to push it back or forward movement, upward impaction, or this impaction, or downward. Some of you, they might know, and they have friends, they did the surgery. Okay, this is called oral and maxillofacial trauma. Okay, dentoalveolar trauma. You must face this one. You must know the principles. You see, my idea of the whole lecture to tell you exactly what's maxillofacial surgery. It can be from simple, silly things to a major things. Still, like this, if you want to be a resident, I'm sure some of you, they like to be a surgeon. This is one of the most important principles you must know. If you have a trauma and you have a patient like this, of course, as you can see, swollen face, but he has no wounds. Are you going to be okay with this patient, or you are going to be sorry, or you know, uh, worried about this patient, or you are thinking of something? If you have closed wound like this, you must be scared. This means that he might have degree of head injury, airway problem, internal trauma that's telling you in another way that I'm going to die. So you must be serious with this patient. In the contrary, you might have, for example, no, I'll show it to you. Open wound. You might have open wound and the bleeding. If you have open wound and lots of bleeding, don't be worried. The only problem that you should be worried about the bleeding itself. The patient shouldn't lose, of course, lots of blood. So you have to replace the loss of volume of the blood. But for this one, you have to know that they might have internal injury, head injury, airway problem, parapharyngeal bleeding, throat bleeding, anything. So you have to admit the patient immediately, do the first aid treatment, A, B, C's, D, E's. You will know about this trauma, okay? You have lectures for trauma. Like this. This is just submandibular abscess, okay? It can be serious, by the way. So the patient, you must do all of that infection, okay? As you know, temperature, and you must do, aspiration if there is pus, if there is, you must do, CT scan for this patient because it can be serious. It can be originated from parotid gland or submandibular gland. But not everything like this abscess. What about this? It's submandibular. Is that right? And this is submandibular. But this is infection. You know what this? This is infected
Sting?
adenoid cystic
Okay.
carcinoma. Infected
Okay.
adenoid cystic carcinoma, which is malignant lesion in the submandibular gland. Okay? But long ستاندنج. هاي الصورة لواحد من بريطانيا، يعني مش بالأردن. الحمد لله قليل في عندنا salivary gland disease like this، بس هناك it's very common. It's cancer, but the patient ignorance. في center of the cancer there is loss or lack of blood supply، بصير infection, and this is there. So don't treat this as infection. You have to treat this patient because has got, if you do good investigations, you will find it in the CT scan or MRI. You will find bone resorption. You'll find, and this is in terminal state, by the way. The patient, he died, in fact. His name is Ryan. I remember this patient, Mr. Ryan. He died from this. So it's not like this means always infection. Do good principles. I'm talking, just to remind you, we are talking about principles of maxillofacial surgery. If you know anatomy, you know what I'm talking about. If you know, okay, embryology, you know what I'm talking about. If you know histology, you know about what I'm talking about. If you know physiology, you know, okay. If you don't know, how you are going to think in this way? انتوا دخلتوا حاليا في المرحلة السريرية الصح، يعني في الأول 3 years they are preparing you. حاليا انتوا والسيرجري هي سلاح ذو حدين السيرجري، لأنه يعني مع احترامي طبعًا أنا لكل التخصصات but what I'm talking the surgery is dealing really with the body but he has got teeth. So please يعني help us in let you understanding this thing. إحنا مكاتبنا دائمًا مفتوحة، في عندنا مواعيد في المكاتب وفي عندنا we are welcoming anybody who want to ask about anything, okay? Regarding anything in the body, not just in the head and neck area. But I'm not يعني taking يعني the place of other specialties, but we can help you, okay? Pre-prosthetic surgery and implant surgery like this. كلكم بتعرفوا على الامبلانت. والبري prosthetic surgery مثلا على سبيل المثال you know if you don't want to do dental clearance, okay? من البري prosthetic surgery في عندنا multiple sockets dental clearance بصير multiple sockets. Are you going just extract let the patient go? Of course no. You must do pre-prosthetic surgery. What I mean by trimming of the interseptal bone. This is pre-prosthetic surgery. Sometimes you might use drill and do suturing if you want the patient to be happy. These are principles. أنا كثير منكم للأسف بشوفهم بيستعجلوا بدهم يخلعوا مشان يخلصوا requirements, okay? بس they are just give local anesthesia, extract, dismiss the patient. لا. البيشنت إذا بتخلع له more than 3 teeth you must do pre-prosthetic surgery لأنه البيشنت he's going to make a bridge or an implant or partial denture or whatever. You must be really do the principle. The principle is to do the pre-prosthetic surgery, which I mean just trimming the interseptal bone and do closure with multiple sutures. Okay? Sometimes you might do drilling just to do roundation. For this is implant. This is how to put the implants. And you can do it immediate implants. And it's very common, immediate implant. Do extraction and put implants and then put bone graft and do suturing. Okay? What do you think about this pathology? This patient, in fact, I did the surgery for her before I went to Saudi, before about 12 years, 13 years. Her son is a doctor. Squamous cell carcinoma of the lateral border of the tongue, okay? Poorly differentiated, which is the worst prognosis. Oral cancer, especially floor of the mouth and tongue, are the worst in the whole body, okay? We have, of course, good differentiation, intermediate, and poor. Poorly differentiated squamous cell carcinoma, which is poor prognosis. Unfortunately, she died after. But we have to do our job. So our surgery can be, of course, now the trend, and I hate tumors. I hate cancer. In fact, if the patient not good prognosis, I prefer to refer this patient to King Hussein Center because they have chemotherapy, they have radiotherapy, they have everything there, and they are my friends, to be honest. But I did this in our hospital, and the patient, unfortunately, she died not from the surgery. She died from aspiration pneumonia. Okay, but succeed, and her son is a doctor. But I tried to convince, and not to, I can't convince her. I tried to tell her that the prognosis is poor. And I told her, and I told her son. But they want to be just, not to blame themselves. And this is what happened. This can happen. Like this is amyloblastoma, which is locally malignant. But look, the disfigurement of his face. Okay? You have to be aggressive. But this is maxillofacial. Okay? This is the hemisectioning of the tongue for the squamous cell carcinoma. Can you see how severe is? You have to resect half of the tongue with neck dissection. We did that surgery for her, which is supraomohyoid neck dissection. Like this one. We are talking about the principles. I'm not trying to tell you that we are doing, I'm the great surgeon, because everybody can do the surgery if he has got good experience and good knowledge. But I'm telling you what's maxillofacial surgery content. This patient, I'm sure you know some patients, they have osteopetrosis. Do you know what's osteopetrosis? It's the opposite of osteoporosis. Increased calcification, okay, of the bone. This means that there is not a good blood supply. If you do extraction and leave it like this, if you just do extraction and dismiss the patient and tell him come back after 1 month, this is how he's going through it. No healing. This is necrotic bone. So what to do? We have to remove all of it and refresh the wound, refresh the bone until we reach. We have to trim it because this is necrotic bone. Necrotic bone means it will never heal by itself. You have to get rid of it. If you leave it, the more you leave it, the more necrotic bone. Please, you have to trim all of it, which means half of the body of the mandible, which means we need really to refresh it. And we might need bone graft later on. Okay? So if you have a patient, you suspect good history, medical history. You have to take good history. Okay. Tell me about, I'll tell you, because I don't think you know, maybe some of you will know. If you want to do implant for a lady that she's got osteoporosis and she's taking bisphosphonate IV, you know that it's absolute contraindicated, especially if the IV taken for more than 1 year. IV, not oral. Okay? Because this is what will happen. The idea of bisphosphonate and treating the osteoporosis, which is هشاشة العظام يعني osteoporosis, is to increase the density of the bone. How? Do you know how? Not by increased calcium.
Vitamin D maybe.
No. But they're usually taking vitamin B.
تكريم الفوسفات.
Sorry?
اتوقع بالفوسفات بتحكم فيه صح؟
Exactly. So it's bloodless. So if you put implants with this, will increase the avascularity, not the vascular, the avascularity. So it will be broken. Okay. Absolute contraindication. We know that now. You know, we have to go back to the principles. Okay. The same like osteopetrosis. The same like Paget disease. You know Paget disease? Paget disease, it depends, increase the density of the bone, Paget disease. If you do extraction in Paget disease, this might end up as well. Okay? Regarding this, as you can see, this is arthrocentesis. This surgery, we do it if you have TMD problem. Okay? We do it arthrocentesis, غسيل مفصل بمعنى آخر. We insert 2 needles and it's very successful surgery. It's minor surgery, but it needs general anesthesia. Okay? This is our as well as our specialty. The most advanced surgery that I did it in Jordan University Hospital is this surgery, which is reconstruction of the joint, reconstruction of the joint. Of course, the reason of reconstruction, it varies. So what we did for her, remove for him, he is this patient, remove the condylar head and part of the coronoid process, and reconstruct with a titanium condyle and glenoid fossa. Glenoid fossa, which is by polyethylene mid-pore, it's called. Okay, polyethylene. It's biocompatible with the bone. So I'll show you now the picture how to do the surgery. No need. You have to be specialized to do this. No need to be worried about these things. How to do the surgery. But I'll show you. This is as well our specialty. This is exactly the part of the artificial material. This is how we cut part of the ramus. This is the condylar head, which is titanium, and that one is mid-pore. This one, you see, this is after cutting it. I'll show you exactly. This is you see, it's atrophic mandible. Okay, of course not cancer. Of course, before we doing that, we have to do an intermaxillary fixation. And this is out. This is the glenoid fossa. Okay, this is the polyethylene, which is the upper part, the glenoid fossa itself. We of course screwing it to the skull bone, and that part you can see it. This one, the head of the condyle, the artificial condyle, and this is the glenoid fossa. Of course, this is from Bionet, which is an American company. So we did this in our university, in Jordan University. Okay.
So how long was the surgery?
This surgery usually it take about 3 to 4 hours, not that long as you think. Okay. Now you have an idea about our specialty. Okay. The whole idea not to show you that how great we are. I'm just telling you about maxillofacial surgery. If anybody he's willing really to be a good surgeon, what he will have an experience, what he might face. But as GPs, you need just dentoalveolar surgery. You need something which is very common, like implant dentoalveolar surgery, minor surgery, removal of wisdoms, difficult wisdoms, cystic lesion. You'll know about these things. But if you want the other part, like cancer, like these reconstruction things, you have to be specialized. Okay? Now, all of you, you know about the medical history, physical examination, laboratory evaluation. No need to talk about all of these things. Is that right? Medical history, if you know a good medical history, good information, it's very easy for you to decide that this patient is safe to undergo planned dental therapy. You must be prepared, of course, when you anticipate the medical problems, like what I mentioned just now. Patient on bisphosphonate to do dental implants, be careful. Okay, bisphosphonate, IV bisphosphonate, oral bisphosphonate for short period, up to 3 years. If he just take one tablet every 1 week, no harm. More than 3 weeks, 3 years, it's harmful. But IV, for me, if the patient take more than every 6 months, they usually take one IV, one injection every 6 months. If she take more than one injection, I'll be worried. Okay. This is just bisphosphonate. Plus, we mentioned a few things. Okay. We mentioned you might expect something, and it's not that thing. Infection can be cancer, as you've seen. Of obtaining histories done well, the physical examination and laboratory evaluation will be very silly. Okay. You must do it, of course, but you planned very well. Of course, history and physical examination, biographic data, chief complaint and its history, medical history, social and family history. All of these, no need to re-talk about them. You know them. Please make sure in maxillofacial surgery, all of these things from A to T, you see, you have to make sure that the patient hasn't got any of these things. Okay. So as you can see, from allergies to TB, sexually transmitted seizure disorders, like what? Like epilepsy, rheumatic heart disease, renal disease, pregnancy, osteoporosis, myocardial infarction. I know, but nobody told me about this list, how big list it is, from A to T. Okay. Routine review of the head. So no need to talk about all of these things. You can read it. Is that right? لأن احنا almost we finished. Okay, you can read it. If you need any discussion or any explanation, you can come. Yeah, it's written on my, in my office on the school, that my hours, office hours, usually in the clinic, and my clinic where exactly in in the hospital, on Monday from 12 to 1 o'clock, and on Tuesday from the same thing, from 12 to 1 o'clock. Even after that, I'm there because I have a clinic and I have office in the clinic. So you can see me alone. So don't worry, not in front of others. If there is any personal things or whatever, I'm welcoming anybody of you. Okay? Uh, Cardiovascular and respiratory system. You know all of these things. The meaning of dyspnea, I'm sure you know it. Any question regarding this? No question? These are the brief maxillofacial examination. Inspection, you can just read it, okay? And examine all of these things by inspection, palpation. Don't forget, especially the things which is not in the oral cavity, like neck, thyroid gland, the size of the thyroid gland, lymph nodes, don't forget it, salivary gland. Today, by the way, today I had a child. He's 2 years old, and he has high temperature, swelling since Wednesday, and today we are on Monday. He's on antibiotic, and he's just 2 years old. I found it's the submandibular gland. Okay, so you have really to know the principles. As I told, I refer the patient to the the radiologist. I found him. He did for him ultrasound and CT scan. But we changed his antibiotic because there's a doctor, I don't know where he saw him. He is written a weak antibiotic and he's not responding. He's just 2 years old. He's a child. But thanks God, because it's painful. These are the principles. Pain usually يعني هو نعمة من الخالق سبحانه وتعالى. الألم usually good prognosis. There is an inflammation, infection, something acute. But if it's painless, this is a disaster. I had another same thing a few years back. He had lymphoma, child, and I'm the one who discovered this. He has high temperature, no swelling, nothing but high temperature. And I did just blood investigations, several blood investigations, and the patient, he has non-Hodgkin lymphoma. I did nothing for him. I sent them. I called my colleague in King Hussein Medical Center, and they received him immediately because kids usually they have priorities, and they gave him chemotherapy. And the patient, he didn't die. Don't worry, he's alive. And she brought me his mom because we discovered it immediately. By the way, malignance, if you discover it early, it's treatable. You have to know this, please. You have to examine the patient very well. Inspection, as I said, palpation, temporomandibular joint, oscillation to temporomandibular, nose and paranasal region, mouth, all of the, you know about mouth. But you have to, percussion, paranasal resonance over sinuses, difficult to assess. طبعا هاي بتاع ENT sinuses. Mouth, teeth, oscillation, temporomandibular joint. Use please the oscillator, بتعرفوا السماعة to hear if the patient has a crepitation, clicking, how much the crepitation, kind of crepitation, if there is fluid, if there is just a crack, crepitation bone to bone, or there's fluid inside. This is just يعني في سماعات وعنا احنا we have so حتى نسمع كويس. بس حبيت أختتم بهاي العبارات. American Society of Anesthesiologists مقسمينها في كلاسيفيكيشن للحالات. هو أهم اثنين اللي عندنا سيف هم اللي هو ASA1 ASA2 هدول اهم اثنين. نورمال هيلثي AS1 طبعا هذا بالاكزامينيشن كل شيء، ولا هي نورمال هيلثي بيشنت هذا سيف تعملوا فيه اي شيء. To a patient with mild to moderate systemic disease and medically well controlled. معظم البيشنت اللي بنشوفهم هذول no problem you can do any surgery وانتم مرتاحين. stage 3 بخوف. a patient اللي هو type 3 ASA 3 third a patient with severe systemic disease that is not incapacitating which is prevent from functioning in normal way. هذا you have to put lots of lines. You must discuss the matter with others. Okay, other specialty, it depends on the type of problem. ASA 4 patient with severe systemic disease that is consistent that's constant threat to life. هذا patient ممكن to die زي ما حكينا البيشنت اللي عنده infected adenoid cystic carcinoma هذا type 4. type 5 هذا البيشنت is dying not expected to survive without the operation. هذا بتاخده regardless لأنه هيك حيموت فلازم نعمل له. هذا ما بتهتم كثير لأنه يعني الموربيديتي very high. type 4 type 6 sorry declare the brain dead patient whose organ are يعني عادة هذا بحافظوا عليهم ليش؟ بس مشان يعني إذا احتاجوا الأورجنز أو whatever. Any question?
دكتور لو سمحت
تفضل.
أسأل سؤال.
طبعا.
دكتور
أيوة معك.
قبل كان في بسلايد عن الهيستوري كان اللي فيها allergy. أوكي تمام.
اللي فيها إيه؟
بسلايد اللي فيه لما ناخد هيستوري كان عن الهيستوري. كان في إنه بريست فيدنج. إيش بيأثر؟
هون إيش؟
وصلني 99.
إيش؟ على الهيستوري هون which one؟ هاي السلايد؟ هلو
اتوقع دكتور انها سالت عن بريست فيدنج انه ليش موجود.
عن البريست فيدنج وينها؟ انا I forgot the slide. الريفيو.
دكتور سامعني؟
سامعك بس
انا
which
كنت
slide؟
بحكي في حدا عامل لي ميوت بس
في حدا
انا
عامل
كنت
لك
وانا بحكي في كان سلايد اللي فيه بريست فيدنج انه ايش بيأثر الكونديشن انه ليه بناخذ له اتنشن.
breast feeding it's very important. very important الميديكيشن. if you give the patient breastfeeding بتعرفي one of the contraindication and can cause really problem with the patient if you give her flagyl. okay flagyl is dangerous to the kids by the way. مع انه sometimes you have to give if they have يعني the kids if they have diarrhea for severe diarrhea بنعطيه بس هذا بيكون عنده intestinal problem. بس البريست فيدنج لازم تعرف اي ميديكيشن البريست فيدر it can go with the blood with the milk by the way it can go to the baby. the idea is to protect the baby. اوكي
انا بس فكرت انه بيعمل complication يعني بالسيرجري او هيك انه ممكن عشان الام بترضع بس عشان هيك.
لا بس طبعا في for example انا if I do for example under GA بعطي المريضة بدها تخلع wisdoms under general anesthesia you have to tell the patient don't feed your baby until مرور 24 hours. ليش؟ لأنه بضل في remnant of the the anesthetic drugs in the body for 24 hours. معناته it will go to the kids. هي the whole idea that not to affect the kids. عرفتي؟
اه
آه.
شكرا شكرا.
any other question؟ هلا أنا متعاون جدا، أهلا وسهلا في أي وقت يا جماعة. حكيت لكم بكرة أنا موجود، في عندي عيادة صباحية مسائية، يوم الاثنين عندي صباحي، وأنا يعني you'll find me. هلا next week طبعا موضوع المحاضرة كمان interested، وإن شاء الله وراح يكون في قصص إن شاء الله. بس أنا هاي المحاضرة بوعدكم راح أوديها لوسيم الليلة، راح أوديها لوسيم، هي زائد الارتكل please you have to read it. أوكي؟ لأنه مهم، اللي هو الكيس ريبورت. أوكي؟ يلا نتمنى لكم التوفيق وفي أمان الله. السلام عليكم.